Good morning, everyone. This is our third case of autism in our series of autism that we've been doing, showing our improved cases that improve very quickly under homeopathic care. So I want to go through this third case if you guys kind of just read through the main complaints of the mother, what she had with this 4-year-old boy. And then I want to read exactly her words after 3 weeks. This was less than 21 days of treatment on the correct homeopathic medicine. Work in progress, but great improvement. So let me just go through this quickly, okay? I'm just going to read off the patient files here. So basically, 4-year-old autistic little boy came to see me. It was May 26th, I believe it was. Let me just check here and I'll tell you. First date and date of the first prescription, May 17th. I'm sorry. May 17th was the first date. So mother comes in, 4-year-old little autistic boy. Main complaints, he was obviously very hyperactive. The poor mother here was having a hard time talking to me. The child was everywhere, jumping on her, wouldn't let her speak. If the mother didn't show the child attention, he would start screaming and yelling, just very hyperactive. It was very hard for the mother. So she had her sister come to help watch the little boy, so me and her could just get like the keys of the case and the way the symptoms of autism present in this little boy, so we could prescribe a medicine. Anyways, main complaints. He flaps a lot, she says. Whenever he's running around, he flaps. So the stimming was a big thing. Delayed speech was huge. She says before the age of 2, he had so many words, and then what happened is, like so many of these kids, is he reverted back to only a couple words. Okay, so the speech was a big thing. Another thing, violence. We see this every once in a while. So extremely violent. Any younger kids, the mother says he will get violent and hit smaller kids. He hates them. He will hit them. He will jump on them. So we've seen a lot of violence in this case. He hits kids at school and he bites kids at school. So this was another huge concern with the mother. Other main issue was sleep. The child tosses and turns, the mother said, and he screams out in nighttime. Whether he's having nightmares or not, we don't know, but he screams almost every night, okay? So these were the main complaints. There's obviously a lot of little issues, but these were the main complaints of this mother. Now, I want to read to you directly from the mother's own mouth, 21 days later, what she reports to me. Okay. Now the mother, it's funny, this case, the mother is still in a little bit of disbelief. She can't believe that this, a couple small little pills that dissolve in water like this of homeopathic medicine, the correct one, could have such an effect. So she's sort of in disbelief, but she can't deny what she's seeing. So number one, she says he's not hitting anymore, which is amazing. He was hitting at school, he was hitting at home, he was biting, he was hitting younger kids. He's not hitting anymore is her words. He's speaking a lot. He's speaking a lot more and more, she said. The night still tosses and turns. He's moving a lot. He's moving around a lot still. Okay, so that didn't change, but he's not dreaming. So he's not screaming out in his nighttime. Before he was tossing and turning, sometimes dreaming and talking and screaming. But she says this is gone. So this improved. What else did she tell me? She says he wants to play more than watching TV. So the mother has to be a little bit busier with him, because before he would just sit and watch TV, but now he actually wants to do activities with the mother. So he's still hyperactive, but you can see that he doesn't just want to sit in front of the TV. He wants to interact with the mother. And this was the really big thing down here. So I'm just going to read directly from her words. She says, before would only answer questions if you wanted to. Before, it was not willing to talk to mom. Now has a conversation with mom. Now he comes to me and talks to us and will answer anyways. Even if he doesn't want to, he will answer. This is huge difference from before. He's talking so much. He's talking extra, she said. He's trying to explain things to her. She says, I was surprised. I was really surprised. These are the mother's words. He had itching, which was a kind of a sub-issue, but he was itching every single night. He says the scratching is less, it's better. Before was asking everyone to scratch him, scratch his back and scratch him all over before bed. That's almost completely gone. She wasn't able to ever clean his mouth, so he always had a bad odor from his mouth. She suspected because she wasn't brushing his teeth, but basically now the odor from the mouth has kind of disappeared, and he actually lets his mother brush his teeth. He opens his mouth. Now this was years like this. So you can see these subtle little changes happening only in 3 weeks. I mean, this is just the beginning. There's still a lot of work that needs to be done, but this is just the beginning of what's happening. Couple other little things. Now is repeating and whispering, by whispering, whatever the mom says, he whispers back now. And he will learn it. After she says it 2 or 3 times, now he learns it. He never did this before. He never repeated or whispered anything before, the mom said. If he did, the odd time would be the wrong words, or he would just look at mom with like a blank stare. So this was a huge shift. And another huge thing which parents love, it's a side issue for us because we want to see the mind unlock. And when the mind unlocks and then the mind's developing and they're able to understand and comprehend and speak and repeat, then the stimming goes away. It's not that we're suppressing the stimming or we're stopping the stimming. The stimming is a side effect of not being able to communicate. When they're able to communicate, the stimming automatically just gets better. So she said the flapping is less now. Before he would flap whenever he was running around and excited. Now, she says, I said, how much less is it? She says it's 50% less. So it's happening 50% less frequent than it was before. Now it's only when there's a new situation or something new that he's excited about. It's not all the time. So this was an amazing case. We're still working on this. The mother's, like I said, it's funny. She's in disbelief, but the changes are indisputable. So she's extremely happy, and obviously she wants to continue. So this is 3 weeks with a couple little homeopathic pills. I'm super happy. The mother's super happy. The child's starting to unlock and starting to, come back to how they were before they reverted. Anyways, awesome case. We're going to be doing more of these cases, series of these cases. Keep an eye out for them. And this is what's possible with all kids with autism, okay? They can heal. Any questions, give me a call. We treat all over the world through Skype. So, distance is not an issue. And that is it. I hope you guys have a great day. Any questions, give me a call.